Hi, my name is Bibek Adhikari. I am your English instructor. In this class, we are going to solve the reading second of Unit 12, that is talking about personal experience. So, let's begin. Alright, we are now going to start a reading second, that is an interview of Unit 12, which is talking about personal experience. In this interview, we will find Mr. Thapa, a reporter of Health magazine, who is interviewing Dr. Razan Paudel, who is a general physician at Civil Hospital, Kathmandu. Let's read the interview. Reporter: Doctor, would you please tell me about typhoid fever? Dr. Razan: Well, typhoid fever is a potentially fatal infectious disease caused by bacteria called Salmonella typhi and Salmonella paratyphi A and B. The disease is common in developing countries like Nepal, where sanitation is poor. Reporter: What is an infectious disease? Could you please tell us how it is serious to humans? Dr. Razan: Infectious disease are caused by pathogenic microorganisms such as bacteria, virus, parasites, or fungi. The disease can spread directly or indirectly from one person to another. You can get infected by touching, eating, drinking, or breathing anything that contains microorganisms. Infectious diseases are serious to humans as they can kill more people worldwide than any other single cause. The socioeconomic impact of infectious diseases is huge because survivors may take several months to recover and resume their work. Reporter: Doctor, how do we know if a person is suffering from typhoid? What are its symptoms? Dr. Razan: During the first week of infection, the patient has a high-grade fever, headache, body ache, and loss of appetite. Constipation may be present, although diarrhea and vomiting may also be common in early illness. At the end of the first week, rashes called rose spots may develop a cough and become profoundly ill unless the disease is treated by antibiotic treatment. In the third week, the patient may pass into coma and die if no treatment is given. Reporter: It seems to be a serious disease. Could you tell us how it transmits? Dr. Razan: It is transmitted via the fecal oral route or the urine oral route. This may take place directly through dirty hands contaminated with feces or urine cases, or carriers of typhoid fever indirectly by ingestion of contaminated water, milk, or food, or through flies. Reporter: Would you mind telling us the percentage of typhoid infected people who visit your department? Dr. Razan: Actually, it is difficult to say the exact percentage as we don't have actual data. Though it can affect any age group, its incidence is highest in 5 to 19 year of age group. Typhoid fever is observed all through the year, but the peak incidence is reported in the rainy season, that is July to September. Reporter: Please tell us its preventive measures. I mean, how can a person be safe from such a dreadful disease? Dr. Razan: Good question. Protection and purification of drinking water supplies, improvement of basic sanitation, and promotion of food and personal hygiene are essential measures to prevent transmission. Hands should be frequently washed using soap and clean water. They should be washed before preparing food, eating, drinking, and after using the toilet. Early diagnosis and treatment of typhoid cases is very important. Next preventive measure is vaccination. 2 typhoid vaccines are available. Oral live attenuated vaccine given on days 1, 3, and 5, and 7 with a booster every 5 years, and other one is parental vaccine, which involves 1 dose with a booster every 2 years. Reporter: I'd appreciate it if you could tell us how we can make people aware of this fatal disease. I'd like to know the way people could be educated on its seriousness. Dr. Razan: Sure. We can make people aware of this fatal disease through health education. People should know the disease is transmitted and its preventive measures. People should eat safe food, drink safe beverages, practice hygiene and cleanliness. If you feel sick and think you might have typhoid fever, consult your doctor. Early diagnosis and treatment is very important because if untreated, 10 to 15% of the people affected usually die of typhoid fever. However, this can be brought down to 1% if diagnosed and treated early. Reporter: Finally, do you have anything to say regarding this disease, doctor? Dr. Razan: Well, typhoid is an easily preventable infectious disease. Simple measures, which I have said already in your question, can prevent us getting this disease. Creating public awareness not only for typhoid fever but all other infectious disease is crucial. Reporter: thank you for your valuable time, Dr. Razan. Dr. Razan: thank you, Mr. Thapa. End of the interview. Now let's go to the exercise portion. The first one is vocabulary in use. Let's look at the first one. The first one is with the capacity to develop or happen in the future. That is potential. The second one is continue after interruption. What is the meaning? So what is the meaning? Resume. Another phrase is having difficulty in emptying bowels. What is the meaning? Constipation. Okay. So these are the words. I think you can find these words yourself. They are not so difficult. We have other words like able to be prevented or avoided. What is that? Preventable? Preventive. Okay. Make something impure by exposure or addition of poisonous or polluting substance. What is the meaning? Contamination. The conditions relating to public health, especially the provision of clean drinking water and adequate sewage disposal. That is sanitation. Very easy. So these words are very easy. They are technical, but they are easy. Now I'm leaving other words. Other phrases to you. That's your homework. You can solve it, I guess. Let's solve the reading comprehension part. In the reading comprehension section, we have questions like, what do you mean by typhoid fever? Now, can you define typhoid fever? I guess you can. What do you mean by typhoid fever? Now, what is typhoid fever? Typhoid fever is a potentially fatal infectious disease caused by bacteria. So you can find that in what Dr. Razan says. It is potentially fatal infectious disease caused by bacteria, something like that. So you can find the answer yourself. This is an easy one. Let's go to another question, number B. What is an infectious disease? So what is an infectious disease? An infectious disease is that kind of disease which is infected from one person to another person, right? So how would you write that? An infectious disease is a disease which is transmitted, or it is infected from one person to another person, something like that. Now you have questions like, what are the symptoms of typhoid fever? You can do that. Dr. Razan has clearly mentioned that. Another question is, what does typhoid fever transmit? Even you can do that. What are the preventive measures? The last section, that preventive measures is also given, right? Now I'm going to give you some homework. So this is your homework. I want you to prepare a colorful poster about typhoid fever with its symptoms and preventive measures. Can you do that? Go to the video called poster writing. If you don't know how to make a poster or a pamphlet, find out ways in which you can make a poster and prepare a colorful poster. That's your homework. With this, we have come to the end of today's class. If you have any questions or suggestions regarding this video series, feel free to write us at learning@deerwalk.edu.np. Thank you.